Good afternoon. Good afternoon to all of you who have joined us today in another episode of the Ask Gunasheela series. And today we'll be talking to you about gamete and embryo vitrification. I'm Dr. Devika Gunasheela and I'm the director of Gunasheela Hospital. And with me today is Dr. Jyothi Menon, a very senior consultant who has been with us for a very long time and is one of the senior most consultants in infertility in Karnataka at this point of time. And she's also the director of infertility services in Gunasheela Group of Hospitals.
Good afternoon, everybody.
So today we're going to be talking about gamete and embryo vitrification, and this is the 12th episode in our series, and this is mainly meant for patients and definitely not meant for doctors. And this is a patient awareness program. You can text in your questions during the program or at any other time to ask@gunasheela.com. And without any further ado, I would like to start the program. Before this, I would also like to let you know that we have had two videos concerning the same topic, and if you go into our Facebook page, you'll definitely be able to see the two videos, which are awareness videos, and it's part of our Gunasheela Public Initiative Awareness Program. So, starting off, we are all women who work in our hospital. Our hospital mainly has a lot of women staff, and we do also feel that everybody should be educated. It's very important for women to be educated, especially in this scenario where many young women are working and are moving forward and are contributing to a large portion of the workforce in every industry and every company. So knowledge is power, and I fully believe modern women should be empowered with more knowledge about their fertility status. And fertility is in your hands, and if you're a couple, it's in your husband and your hands. So basically, nobody else is involved in your fertility. It's only the two of you who should make the decisions and who should have the liberty and freedom to make those decisions. So without any further delay, we are talking about freezing of embryos and freezing of gametes. Now, what exactly are gametes? Now, gametes is a medical term which is used for the two structures that come together during reproduction. So what happens? Males produce the sperms. Sperms are the ones that will carry your DNA material and have to fuse with the eggs, okay, which the females produce. So in all species, females produce the eggs, males produce the sperm, and the sperm and the egg have to fuse. And once they fuse, that process is called as fertilization, and that gives rise to what is called as an embryo. Everything starts off with a cell. So once the sperm and the egg fuse, they form a single cell, which again further divides. In one cell divides to 2, 2 to 4, 4 to 8, 16, 32, 64, etc. And then it gives rise to an embryo, which then is the baby. And if that embryo goes and sits inside the uterus and is held by the uterus, it becomes the future baby. So,
and here I just want to also emphasize that if at all you're unmarried, then it is recommended for the women to freeze their oocytes.
Yeah.
And once they're married, it is recommended to freeze the embryos.
So you can freeze the sperms, you can freeze the eggs, you can freeze the embryos, you can freeze ovarian tissue. There are so many things that you can actually freeze. And
depending on your particular situation.
Exactly. So now let's go on to sperm. Sperm, can you please tell us, Dr. Jyothi, when is the sperm vitrification actually really indicated?
See, there are two definite situations, should I put it like that. One definitely, which we are doing a lot in our hospital also, is because we are helping young cancer survivors.
Yes.
So we are helping those patients who before they start their cancer therapy, to vitrify their sperms, because chemotherapy and radiotherapy are known to be gonadotoxic, and they will cause some definite detrimental in the sperm quality later on, which may pick up, but this is a backup sample in case it
Correct.
doesn't.
Yes. Yeah.
Okay.
Now, I think we must actually talk about what is vitrification, what is freezing, and what is vitrification. So,
And also we wanted to also emphasize that
yeah.
this is a backup plan.
Yeah, this is the backup plan. Yeah, I just want to tell you one very important point, which both of us want to tell
Yeah.
you. See, when you're talking about either storing your sperm or your egg or your embryos or whatever, this is not at all a substitute to natural conception. We will always say that you have to try to get pregnant the natural way, and this is only a situation, this you do as a backup. So we will come to that in course of time, but this is, we're not in any way suggesting that,
That
you
everybody goes for this.
everybody goes for this, or everybody should do it, and everybody should get pregnant with only frozen embryos or frozen eggs.
Eggs.
Okay, so you have to try naturally. This is not a substitute for trying naturally and getting pregnant in the natural way, which is the best way, because you get pregnant that way, you kind of proceed through pregnancy first class. There is no problem, you will just sail through everything, there is no problem at all. So we want to emphasize that you should try pregnancy naturally, but if it doesn't happen, you should have,
There are options
there are
available.
options, yes. So what exactly is actually vitrification and freezing, and we're using these terms, so I think we should actually explain that.
Yeah.
So vitrification, freezing is putting it into a very very cold atmosphere, and in our science we use liquid nitrogen, and we store the sperms or the eggs or whatever it is at minus 196 degrees centigrade. So that is what we use as freezing. Now, before, in the olden days, there was something called a slow freezing, which would take a good 1.5 2 hours to freeze any gamete. So if you had to freeze an egg, it would take that much time. If you had to freeze the sperm also, it would not take that much time, but it would take less time, but you still had to freeze it slowly. Now, maybe sometime around 2013 2014, or maybe earlier than that in the west, but in our country definitely around that time, we always get, India always gets
A little later.
all
All the technology a little later
a little
than
later,
the rest
yeah,
of the world.
yeah. So when vitrification came in, we thought it was a fantastic procedure, but then it still had to be standardized, etc., etc. And then what we did find is that vitrification took a shorter amount of time. So vitrification is fast freezing. So the only difference between the old and the new is that it is a fast freezing procedure. It requires a little bit of technical expertise, but it has the same or even better recovery rates, and it can be done very easily in the lab, and it is very less time consuming. So,
and unlike the slow freezing, which required a very cumbersome equipment,
yes,
this does not require
so much of equipment. Yes, correct, exactly. So the whole world now has moved into vitrification rather than slow freezing. So we were talking about,
sperm vitrification,
yeah,
like I told you, definitely for cancer patients.
Yeah.
And also during infertility treatment, there are certain situations. Maybe they're just coming for an intrauterine insemination, or they're coming for the IVF procedure, and for some reason the husband is unable to be present during the time of these procedures on the wife, and so he gives a backup sample. Or also during the procedure of IVF, on the day when we want him to give a fresh sample at the time of egg pickup, for psychological reasons, some reasons, he is unable to give a sample or gives a very bad sample. So in these two conditions, we ask them to freeze as backup samples to be used during the time of the infertility workup.
Yes, and this kind of backup sample has kind of saved us a lot of the times.
Many times.
It's very important to do that. And so is Oocyte vitrification we were talking about from 2013. So anything that you want to say about that?
Yeah, see, earlier, because like Dr. Devika has been discussing with you all, the procedure of slow freezing was not giving that fantastic results, and like we already mentioned, it required a lot of cumbersome equipment. It was quite time consuming. So over time, maybe by about 2010 in the West, and in our country by 2013, people had sort of standardized the vitrification technique.
Yeah.
And they were able to understand that it gave, in fact, equal or even better results than the slow freezing process. So at that time, the American Fertility Society brought out guidelines, and initially they were talking about oocyte vitrification as being in the experimental therapy.
Yeah.
But in 2013, once it was established that vitrification of oocytes was going to give you very good results, and there was fair amount of pregnancies by that time, they removed this particular
Yeah, this whole
classification.
experimental. So the thing is, it's no longer experimental, and this came in, I think, in the context of trying to save eggs and ovarian tissue, for women,
Women.
who were actually having cancer. So that was
Cancer.
in that
It
whole.
started that way,
started
and then
that
it
way.
got expanded to regular infertility.
Yeah,
also.
yeah, and
Okay.
oocyte vitrification is relatively recent. If you talk about recent, maybe 20 years, etc., or maybe 25 years, when compared to embryo freezing, which has been happening for a very long time. So that is why we're talking about oocyte vitrification, because it's a comparatively recent procedure. Embryo vitrification is done, is standardized, it's there. Every whole world is using it. It's the oocyte vitrification now that has been no longer considered as a experimental procedure.
And up to now, more than 1,500 babiys have been born from vitrified oocytes. So
yeah.
it's well established
Yeah,
now
yeah.
that you will get nice babies
Correct.
without any problems.
So age, now the most important factor that is going to talk about your fertility is your age. Okay, that is very, very important, and we can't change it. We can't stop time. We are all moving and forward, and we are all aging, and fertility does decline once a woman becomes older. I think the best time for one to have a baby would be maybe between, shall we say, 22 to about 32, 33. After which there is a slow decline, and after 35 it is a faster decline. And
this happens even in men, but at a much later stage.
Yeah, much later stage and more subtle. And maybe at around 45, 50, their fertility starts to decline. So it's very important to keep note of that age is the only determinant of your quality of eggs, and we'll come back to that later. So we have also kind of covered this. You want to say something about that curve that comes down like that?
See how, like Dr. Devika was mentioning, initially, this we will talk a little more in detail why it happens more in women and not so much in men. In women, like she said, till about 30, 32, the fertility slowly reduces. But then there's a rapid decline after the age of 35.
Yeah.
So, sort of between 33 and 35, 36 is the crucial period when you should really take a very quick decision as to how you want to proceed with your fertility treatment.
Yeah, and one interesting point that I want to actually bring in here is that, we can't compare ourselves to the West. The Western woman. We're a different, genetically different, completely different group, and there are also studies, also some from India, which have actually come out saying that Indian women reach their menopause 5 years earlier, 5 to 6 years earlier than their Western counterpart. Okay, so that is something that you should keep in mind. So suppose you're Googling something about menopause and you're looking at shall we say, a European website, they are quite okay. You're at 40 years, they're producing good quality eggs. Whereas with us, it's not like that. And I'm seeing, and both of us are seeing many young women all coming at the age of 32, 33, 34.
Extremely low ovarian reserve.
Extremely low ovarian reserve, which is not, shall we say, concurrent with their age. It may be extremely low, or it may be decreasing. That's another thing. So that is something that makes us sit up in our chair and say, hey, you're all okay. You're only all of 32, and you're very, very young. And at 32, you're at the prime of your life, but your ovarian reserve is slowly decreasing. So sit up and take attention.
And they could still be having regular cycles. In fact, many of them, when we tell them this, because we have a large infertility population, they are so shocked that because they are otherwise extremely normal, getting regular cycles. Everything else about them is fine. So it's very, very important, because we have found this over the past 5-6 years, definitely, because we've been doing so many of this, testing ovarian reserves in young women when they come for infertility, and then we find this out.
Yeah. Exactly. So what exactly? So now let us just talk about women now. Now, women are born with a certain number of eggs. That is a predestined number. When you're in your mother's tummy, you have that number of eggs, and you come out like that, and there's nothing that anybody can do to change that. So on an average, women are born with 10 to 20 lakhs of eggs at birth, and then decreases to 30 to 5 lakhs at puberty, which would be about anywhere between 10 and 13 years of age or 14 years of age, and nobody gets pregnant at that point of time. So as you reach your reproductive age, which will be maybe around 22, 23 or whatever, then you're only left with about 1.5 lakhs of eggs, because with every cycle to produce one good quality egg, hundreds and thousands of eggs are destroyed. So that is the way a woman's ovary works. So to produce one egg, hundreds of eggs are destroyed. So that is why women reach the menopause early and cannot after that have babies by their own eggs. So
neither can you increase the number which is going to come in,
no,
nor can you reduce the rate of depletion.
You can't, yeah.
So both are not in your hands.
Yeah. So that is something that you need to kind of really understand. So by the age of 37, you only have about 25,000 eggs, and you may think, oh, I've got 25,000 eggs. That's a hell of a lot. I only need one egg and one sperm to make me pregnant. But that really is not the way it works, because of what we have said until now. And about 1,000 eggs at menopause, which are anyway finally no good. So after the age of 35, the not only does the
the
quality also decreases. Correct. Yeah. And so basically, so it will be a good idea to kind of find out how many where exactly you lie on your fertility status, especially if you're reaching 30 or you're gone over 30.
So this is what we were talking, that it doesn't matter even if you have 1,000 eggs.
Yeah.
They'll also all be of poor quality.
Poor quality, yeah. But then there may be, so why are they of poor quality? That's mainly because of chromosomal problems.
Correct.
And genetic problems. So that is why women who are over the age of 35, we've shown you the decline in fertility as well. And what happens is that after the age of 35, because your eggs are not of good quality, there are genetic problems that happen in the egg, which translate into either a no pregnancy or a miscarriage, or sometimes you can have babies that are abnormal or mentally challenged, intellectually challenged. So that really, if you were, shall we say, 35, if you're 30, you have approximately, I'm only giving you approximate numbers, 1 in 1,000 chance of having an abnormal baby. But as you become 35, it's 1 in 350, 38, 1 in 280, shall we say 40, 1 in 100. So you can see that the chances of having an abnormal baby starts to increase as your age increases, and that's mainly because of the oocyte becoming older and thereby having genetic problems. But also there may be other problems as well, and like, for example, fibroids, tubal disease, endometriosis.
As a woman ages, all this naturally comes, and it adds to the problem of a chromosomally abnormal oocyte also.
Correct. Yeah. So you also have adenomyosis. So lots of other problems which come in because the woman is aging. So you want to tell us now how much what is the kind of if you have to try naturally?
So but the younger you are, you have a better chance every month.
Yeah.
Almost 20% chance of conception when you're around 30 years of age. But when you go up to the age of 40, it reduces to about 5%. Correct. So it's very, very important that you decide, okay, this is my age and this is my chance of natural conception.
Yeah.
So if I haven't conceived within this amount of time, I should probably seek medical help.
Yeah, correct. Exactly. So coming to that, when do you actually see a fertility specialist then?
Yeah, so if you want to, again, we are coming back to the age, and we have sort of taken 35 as a cutoff. So when you're 35, yes, you try on your own for a little while, but in our opinion, 6 months is the maximum where you can try on your own. And after maybe some basic investigations, but then you really need to come to a fertility specialist by the time you are have tried 6 months and you're around 35 years of age. But if you're going closer to 40, maybe even before you start trying, or maybe within 3 months, if you just say, okay, let me just try 3 months.
Yeah, at the age of 40, you better quickly rush to whoever this fertility specialist is. Don't waste too much time.
So again, we want to emphasize age.
Yeah, age. Yeah, finally it's the age. Yeah,
woman's age, which is critical.
Woman's age talks about the quality of the eggs. Okay, yes, it does. There are other tests which can also tell you about the quantity, but the quality is mainly determined by the age. And the better the quality, better the
Better.
chance of pregnancy. Also, along with that is also the more number of eggs, the higher the chance of cumulative pregnancy. So, can you tell us something about the male, Dr. Jyoti?
So yes, for the men also it makes a difference, but it luckily for them it's at a later age. And
Yeah.
I just want to emphasize what you had said. Unlike the oocytes,
Yeah.
women
Yeah.
are unfortunate because we cannot reproduce
We're disadvantaged at all times.
because we are born with limited number of oocytes, unlike the men
Yeah.
who continuously produce sperms at 3 monthly intervals.
Yeah.
And this goes on. So they produce new batches. They're very lucky in that way. They produce new batches at least every 3 months.
Yeah.
So that's why we talked about pooling, because you can get a bad sample this month and 3 months later you can get a good sample.
Yeah, exactly. Yeah.
So
Yeah.
that's not the possible with women,
Yeah, correct. Yes,
unfortunately.
yes.
So that's the reason why, yes, it does decline, but in the men at a much later age, 40 to 45. And like we've spoken, you can pool the sample and get a good
Yeah.
sample in the end, which you can't do with women. And normally, naturally, that's what we mean. And as the male increases in age, you have other problems, because you can have reduced chances of pregnancy, increased chances of miscarriage. And there have been some studies which have shown that in fathers who are over 40, they have other problems. In the
I think
children,
45, something like that,
45,
maybe.
yeah,
Yeah.
maybe. They develop like autism related disorders or schizophrenia, mental illness. These are all small studies,
There are
maybe.
also more
Very,
than 50.
yeah,
They can have epigenetic disorders. So that is
yeah.
something that comes in. Uh,
So even for men earlier,
yeah.
I mean,
Yeah.
maybe 40 is the cutoff. We should ask them to really come,
Yeah,
or
and you know
later.
what? Suppose a man who's about 55 comes in saying that he wants a child, which is all okay, fine, he'll still be producing sperm. But then, actually, if you look at it, by the time his
Yeah,
son is 70, son or daughter is 20, he's already 75.
70.
So it's not such a ideal scenario. So I think men also should kind of, pull up their socks and,
Yeah,
you know, try to get a child early.
yeah.
So,
We have spoken a bit about this,
hmm,
as to when should a woman come for oocyte
yeah,
vitrification.
yeah,
One, again, like I had mentioned, for men, it is definitely those women who are cancer survivors
hmm,
and who want to undergo, they've undergone surgery,
hmm,
or they've not yet started treatment, but before they start the chemo and the
yeah.
radiotherapy, we want them to come and give off their either oocytes or ovarian tissue if they're unmarried. And if they're married, they can even freeze
Yeah, and we are
embryos.
actually in our hospital from
We do.
2011, I think, right?
Yeah.
We have been doing this on a charitable basis, and now we are freezing oocytes or that is oocytes are eggs or sperm or embryos or ovarian tissue sometimes for
Depending on whether they're married or unmarried.
unmarried, etc. For that is another whole talk itself.
Itself.
But then we've been storing them free of charge for 10 years. So that we're doing as although we're not a corporate, we're doing it as our responsibility and give back to society. And I think that is very, very important that people know it and spread the message that if you do have anybody who is unfortunate enough to have been afflicted with some kind of a cancer and who's still in the reproductive age group, we can help them out by storing their eggs or sperms or embryos before they actually go in for chemo or radio, because these modalities of treatment do decrease their fertility.
Okay, I also want to mention here about the difference in storing sperms in men and oocytes in women.
Yeah.
Because, like we had already discussed, even though the procedure itself, the chemo and the radio may affect that, they can recover because they reproduce fresh quality of sperms.
Yeah,
Men.
like the testis is a
Yeah.
sperm producing factory. But
Unlike women.
yeah, yeah.
So it's more important for them to freeze oocytes.
See, it's in women. It is like uh, it's like a go down. So you have 100 sacks of rice. So the first time you take out 10 sacks and it's gone. So there's nothing to replenish it. So it's only whatever you have that is coming out to the surface and is being released. And that's it. That's the end of the story. And then you're left with 90 sacks. So the next time you take out another 10, you're left with 80. So that's all. That's what happens. There's no mechanism where it can be replaced. Unlike in men.
Unlike
Yeah.
the testis.
So there are other conditions also,
Yeah,
right?
so other conditions were women with autoimmune disorders or women who have like some kind of genetic problems like fragile X syndrome,
Yeah.
some kind of problems which will predispose them for to premature ovarian failure.
Yeah.
So these kind of patients, they are recommended to have at least the oocytes frozen, and along with that very severe degree of endometriosis where again the ovarian function is compromised.
Yeah.
Or also in those patients who feel that okay, we have got already very low response and we feel we want to undergo a couple of cycles of stimulation, egg stimulation, freeze the eggs, they are still unmarried.
Yeah.
They were married, they would probably go for embryos. So then they will pull the oocytes in case they're already, because it's only going to become worse every month.
Yeah, correct. Yeah.
And the last call, this thing is, this is as far as the women were concerned. Sometimes what happens is, we've had this experience that in the couple, the wife is undergoing the IVF cycle and the egg pickup. The husband has always had poor egg quality, poor sperm quality, but he says no, on the day of the egg pickup, I will try to give a sample by ejaculate. Or if he has had something called like obstructive azoospermia, where the passage of the sperm coming out to the outside is blocked, then on the day, for whatever reason, we haven't got backup sample, on that particular day, if he's not able to give a sample and they're not willing to use donor sperms, then we can go ahead and still do the egg freezing.
But
later on, whenever these are extreme situations. But these are basically medical conditions for which we think. There is another very, very important thing, which I think Dr. Devika would like to talk to you, and this is this is one of the videos we have released, which is really very patient informative. I really suggest that all of you watch this.
I think like now we are kind of, the circumstances have changed to what it was in, shall we say, my mother or your mother was alive, to what it is now. And like I said, women are...
I think we must go along with the times.
Yes, we should move along with the times.
Give patients what they want.
Yes. And also, we should understand that more and more women are working now, more and more women are forming a huge workforce, and they are climbing the corporate ladder. They're wanting to... I have many young women who say, I'm not ready to settle down, and they're already 27, 28, or have passed the, what shall we say, the conventional Indian...
marriageable age.
So...
And marriage immediately means babies.
Which does not necessarily have to happen, because you're still okay, you can still be married, you can still, lead your life. And then like somebody was telling me the other day that, her daughter and her son do not want to have a child until they have 1 crore in their bank account. Now that's a huge number. And whether she actually meant that as a joke, or whether she actually was, they meant it really, realistically speaking, I do not know. But then a lot of couples have their aspirations and their goals, and they do feel that having a child is going to limit them. Some also feel that, okay, I can't have a child and I give it to my mother and, allow her to kind of look after the child, and then I will carry on with my life. So when you become a mom, you have to look after your own babies and you have to bring them up the way you want. So we are now coming to the realm of social egg freezing. And what is social egg freezing? So here, if you do not want to, if you have not found your ideal partner, or if you feel that you're not yet ready to settle down in life, or you're gotten good job opportunities and you do not want to kind of confine yourself to a single place or a single person or whatever, but you're getting on in life, you're getting older, and you're worried that you do have that longing that you will want to become a mother sometime in your life, this is something which you can actually consider, where this is like you must look at it like a fixed deposit. You keep some money in the bank which you may use, you may not use for a rainy day, but it is still there. So this is where social egg freezing comes in, and you can actually keep your eggs frozen. You can get yourself stimulated, freeze your eggs, and keep them. Not necessarily that you will use it. So suppose you do find an ideal man, or you do find a situation where you feel, okay, now I'm settled in life and now I want to go ahead with, having a baby.
So here again we want to emphasize that time try naturally.
Yes. You must try naturally. There is no substitute to you trying naturally and getting a natural pregnancy. But if that doesn't work for a few
Hmm.
years, and then you go to your fertility specialist, and then they discover that you do not have the sufficient number of eggs, or your fertility has come down, then you can say, okay, no problem. I've
I've
already
got it.
got my eggs,
Which are much younger.
which I have frozen. Now, suppose you're 35
Hmm.
and you've frozen your eggs at your 30. That's great. You've done a fantastic thing, because then your eggs are still there. They are younger eggs, which are more capable of producing a better and a healthy baby than what 35-year-old eggs or
Would
36
be.
year old eggs would do. So that is something about social egg freezing. So the younger you are, the better it is to freeze your eggs. Obviously, we don't say that somebody who's 20 should go and freeze their eggs,
Yes.
but you must take it in the right context. And
This I think
this
we've
is
covered
we've
quite a bit of
covered
this.
this a
Most
lot.
of it, yeah.
Yeah. So one thing is, you can freeze your eggs, and if there are couples who are actually again touring the world, settling down, and not financially not stable enough to kind of start a family, they have in their own minds, like, before I start a family, I want to have so much in my bank account. I want to do this. I want to do that. I should have finished it. In my
I
own
want to see
self,
the world.
I want to see the world.
So a lot of things they
Yeah, a
have.
lot of things. You can
Yeah.
also freeze your embryos, and embryos are frozen when you have either a steady partner, or you have a husband, and both of you are on the same page of not wanting to have a baby. And so if you say, okay, fine, I'm not ready now, but then I'm 30 now, or 32, and I want to have a baby sometime later, and I do know that my fertility only decreases as I grow older, so I'll freeze my embryos now, and I might come back to it at a later stage if I can't get pregnant naturally.
Naturally.
Yeah. So that would, can you tell us now, how do we actually understand where on the fertility scale we are, and what would you tell our young patients to do?
Yeah, as far as the men are concerned, of course, it's the semen count.
Yeah.
But for women, there are two specific tests. One is a very simple ultrasound, which we ask them to undergo. It's a transvaginal ultrasound, ideally done on the second or third day of your cycle.
Yeah.
And there is a count
Yeah.
for it to be normal,
Mm.
and it should be more than about 6 to 10 in each of the ovaries.
Right.
That's how it, up to 12 even.
Mm.
And we do have a very specific blood test which has
Yeah.
come now. Before
Yeah.
there were a lot of other ones,
Yeah.
but now the serum anti-Mullerian hormone,
Yeah.
the AMH. The advantage of this is really can be done any day of the cycle.
Yeah.
The only two this thing is it shouldn't be done when the woman is pregnant, of course,
Yeah.
which may not even be required, or if she's be on any hormone related medications.
Yes, correct. Yeah.
And anything below 1.1 is considered to be
Yeah.
low.
Yeah. Okay. So one point. See that how it goes is that if it is between 1.3 and 4, we consider it normal. Anything more than 4 it means that you will produce excess number of eggs. Anything less than between 0.5 and 1.2 would be
Yes.
low, and less than 0.5 would be very low. So that is that area where we have a lot of trouble, trying to get eggs for them, and that's when our egg pooling, embryo pooling, etc., all works out. So there are very simple tests. AMH can be done in just a blood test, and the other one is just a scan.
Scan.
So really, it's not so difficult to find out where exactly you stand on the fertility scale. And
Yeah,
this
I
is
also want to emphasize here, of Devika, that yes, these are things which will help us. But again, the one input, this probably tell us the quantity, but the quality is
Yes,
determined by
but the
age only.
Yes, yes. And if you also want to kind of download, that is this thing which is called an Indonesian calculator of oocytes. It's an app which will actually. I mean, I have downloaded it, and some of my doctors also
Yeah.
have downloaded it, and it is it's just a rough estimation as to if
Depending
you're
on your AMH level and
and your
which
age. Yeah, so if you're a particular age, what should your AMH be? So if you have your AMH, then you can put in your AMH, and you can see at what age would an
You
AMH
probably really,
yeah, like if you put in your AMH, then it would be like, what would your age have been if you had this particular
biological
AMH?
age, not chronological.
Yeah, correct. So like, for example, so if you're 25, your AMH is some 3.5 or 4 or something, excellent. Okay, so but then if you're, shall we say, if you're 28 and your AMH is 0.5, then that is not the age at which an AMH would be 0.5. Your 0.5 AMH would be most probably 42 or 43. So that gives you a slight idea as to where you stand on the fertility scale, but we're not going to talk too much about this.
That-
It is something that we came across.
Yeah.
And
See, another thing, this is just a little bit off from whatever we are talking, but we also want to emphasize that it's better you become pregnant at an earlier age, because as you grow older, when you become pregnant, there are additional complications because of age.
So we are going to take on the roles of mothers and grandmothers now, saying become pregnant early. Yes.
Yeah. So all the problems of whether you are going to get diabetes, whether you're going to get blood pressure, whether you're going to have multiple pregnancies because you require assisted conception. So all these things, plus other things like cesarean sections, or in case for whatever reason that baby is not growing properly inside, delivering those babies early. So all these complications come. We have seen in our practices that this all happens as you grow older.
Yeah. So basically our bodies are made to have, everything has a particular time at which your body is going to be compliant. So between the ages of, shall we say, 20 and, shall we say, 35, 36, even 40 maybe, it's okay to have a baby. But then after that, it becomes a completely different ball game, because your physiology changes. Whether your body is able to handle pregnancy, which is an added stress to the body, is another different story. So do think about getting pregnant early. That is just the basic baseline.
So I think we covered this quite a bit
lot,
of this. Just to tell you all that what are the results. There has been a lot of embryo freezing which has been done, and overall the survival rate of these embryos which have been frozen is around 95%.
Yeah, embryo freezing has been done for a long time. It's very easy to do, and our embryologists know how to do it. Doctors know how to deal with it. So it's quite an accepted form, right? It's the oocyte freezing that then comes into play.
And also, for whatever reason they want to freeze embryos, they have a 75% chance of pregnancy. Because that has happened we have persistently got 75% chance of pregnancy whenever they have come for a frozen embryo transfer. But as far as, the worry was always for a long time about the egg freezing. So, but now, like we have discussed, vitrification has been standardized. They've been able to get better results. But again, you need to do younger so that you'll get more number of eggs.
Yes, exactly. The main formula is, when you're young, if you freeze them, it's better than when you're freezing it at 35 years of age because you want to have a baby at 42. Neither of which is ideal. So if you want to freeze, you wake up and you start understanding, what your fertility is like and what your body is going through. And so the younger you are, the more eggs that you'll get, the healthier eggs that you get, and so hence the survival rates are better once you thaw them, and also your pregnancy rates are going to be much better. Of course, it is not like your embryo. If you have if you store about 10 eggs, you get a cumulative birth rate of about 42%, which is okay considering the fact that if you were 40,
if you hadn't stolen, it would have come down to about 15%.
Yeah, exactly. Yeah. So really, it's not too bad, and that is a viable option to consider.
Everybody talks a lot about healthy lifestyle. Is it going to change? Because age is not going to change.
Yeah, definitely.
Okay, the other things may help.
Yes.
But along with that, a quick decision as to what you want to do with your fertility problems.
Yes.
That is most important.
Yeah, I'm sure you've heard all about this. Eat healthy, drink plenty of water, sleep nicely, exercise regularly, don't eat too much. Food is not really as great as it's supposed to be made out.
So it is important to do all this. Especially when you are coming for the fertility treatment, it is important to do all this.
Stop smoking, right? Stop pan parag and that kind of stuff, which is all
lifestyle changes are required. We don't deny that at all.
Yeah,
but it does not substitute for age.
Yes, that's about that. So really. And especially in this time of COVID, also everybody has to kind of lead a healthy lifestyle, increase your immunity, eat more of, shall we say, sprouts and a lot of colored vegetables, which
and
has a high
fruits.
level of antioxidants, some amount of exercise, reduce your stress. So all that is very important. Don't put on weight during the lockdown or this working from home situation. So I do hope that we have given you an insight. We strongly recommend that you
Watch
see
the
our
videos.
public awareness videos, and which will give you a little bit more information. And please watch out for our next program, which is painful menses, a periodic cry of the uterus, on 29th August by Dr. Jyothi and Rajam. And you can text in your questions, and if there are any questions, we'll be happy to answer them right now. But you can write to ask@gunasheela.com, and if you also want to talk to us about it through video conferencing or Skype or any other mode where we can see you and you can see us, or what's that called, the WhatsApp call, etc., chat.
Video chat.
Definitely, yeah. You can write to ask@gunasheela.com and get an appointment, and we'll be very very happy to help you out. So thank you very much for having attended this live program, and we wish you a healthy and a safe time till we meet you next.
Thank
Right?
you. Thank
Thank
you
you
for
again.
listening in.
Okay, bye.